Hi, I'm Dr. Kevin Leach. Today we're going to talk about chiropractic. So what is chiropractic? Chiropractic is a profession where the doctors analyze the spine for what are called subluxations. So a subluxation, very simply, is a misalignment of the bones in your spine, and that misalignment will put pressure on the nerves or interference with the nerves that control everything in the entire body. So a lot of chiropractors may do other things as far as nutrition and therapies and things like that, and that's okay. But chiropractic in its pure essence is analyzing the spine for misalignments called subluxations. So a lot of people ask, what's the difference between a medical doctor and a chiropractor? So the educational process for both is strikingly similar. I think chiropractors actually have about 100 hours more coursework than medical doctors. And chiropractors have 3 times as much neurology education than medical doctors. And this is probably because we deal so much with the spine and the nerves coming out of the spine, so we need to know a little more about what's going on. One of the main differences clearly with chiropractic and the medical profession is at some point medical doctors will start to study pharmaceutical drugs and how to treat symptoms and treat disease, when chiropractors will start to learn how to adjust the spine and different techniques to adjust the spine and remove those subluxations. Some of the stigmas with chiropractic are, once you go, you always have to go. You don't build up a need for chiropractic care after you go to a chiropractor. Chiropractors will always recommend wellness care for everyone because anyone with a spine is susceptible to subluxations, and not having subluxations in your spine will make you healthier for the rest of your life. So the other main stigma with chiropractic is that it's only for neck pain, back pain, and headaches. At some point in history, patients demanded insurance companies cover chiropractic care because they saw the benefits. There was a compromise between the chiropractic profession and the insurance companies that they said, okay, we'll cover chiropractic, but only in cases for neck pain, back pain, and headaches. And so the chiropractor said, great. So they put up their shingle and they put up signs that said neck pain, back pain, headaches. So the chiropractic profession was pigeonholed into a public understanding that it was only for neck pain, back pain, and headaches, when it's actually it can help with hundreds of other conditions, hundreds, because the nerves in your spine and that come out of your neck and your back control everything in your body. And if you have interference with those messages, it can create problems. So what do you go to a chiropractor for? And when would you go to a medical doctor? Well, the medical profession in general is very good at emergency care. If I get into a car accident, I don't want to see a chiropractor. I want to go to the emergency room, see a medical doctor who can save my life and see if anything's broken, dislocated, and make sure that I'm stable and save my life. Afterward, I want to see what kind of injuries I've had to my spine in that accident, which a chiropractor can then correct. Another reason to go to a chiropractor is for health conditions that aren't resolving. Things that are lingering on. You've had back pain for a while, it's just not getting better. You might have seen a physical therapist, a massage therapist, it's just not getting better. You have digestive issues, you have dizziness, you have migraines, things that just don't resolve. There's a cause. And I always tell all of my patients, whenever you have a health condition, you seek the cause of the condition. Don't just cover up the symptoms, you seek the cause of it. Many times it's a misalignment, it's a subluxation in the spine that's causing your body not to function the way that it's designed to. So that's when you would see a chiropractor. And the last question that we talk about is, what do we want to look for in a chiropractor? What makes a good chiropractor? A good chiropractor will analyze the spine very specifically, find the subluxations and remove those subluxations specifically using a protocol to find them, remove them, and then to do more exams to see if they've actually removed them. It's not just a general manipulation. Another stigma in chiropractic is, people make that cracking sound, crack, crack, and those are very general manipulations. What to look for in a good chiropractor are very specific adjustments that remove those, and then they check to see if it's actually removed. X-rays are another very important factor, because if you have damage to your spine, we need to be able to see that. So X-rays will show if there's any contraindications to a spinal adjustment. So X-rays are very important as well.